Now let's dive deeper into our Hawaii edition and begin with the Kirinyaga County specific stories. The COVID-19 pandemic exposed the crevices in the healthcare sector, with governments finding themselves in a tight space. The great surge in demand for healthcare on one end amid limited resources on the other. One of the ways forward has been the investment in facilities so as to make access easier and ultimately more accessible. In Kirinyaga County, Governor Waiguru prides herself in the investments her government has made to this end, which include construction of a large complex in Kerugoya as well as various other upgrades. NTV's Melito Letenges reports on how Kirinyaga County is bolstering the health sector.
Charles Mwangi takes feeble steps to recovery after undergoing ankle surgery at the Kirugoya Hospital, having been involved in an accident. Just like his steps, he says his home county of Kirinyaga has made its own strides in making healthcare more accessible.
In fact, formerly we used to go to some x-rays from here to Nairobi. Like we say CT scan, MRI, such things, ultrasound. People used to travel more far.
Health infrastructure had and has been a hurdle for areas that lagged behind before devolution. So for the residents who are beneficiaries, this is not just development, but a promise of better care.
Ukiwa na kanyumba kidogo, mambo yako itakuwa kidogo. Lakini ukijenga nyumba kubwa, mambo itakuwa kubwa. Now we have a complex here. The staff who will be working there will be more than those who are working here.
This is the new face of the Kirugoya County Referral Hospital, towering above Kirugoya town, a landmark of sorts. The county government is in the process of the upgrade from this old facility, built in the colonial era. This is one of the various projects County Governor Waiguru is looking at riding on to boost healthcare in the county. Others include construction of an eye unit in Kirugoya, construction of a modern incinerator, also in Kirugoya, as well as the establishment of maternity wards in Sagana, Kembembe, Kirinyaga and Gariama sub-county hospitals. Further, the county is pumping resources into procurement of 3 ambulances, construction of a TB isolation ward, and the completion of 29 dispensaries.
We have built an ultra-modern hospital in Kirugoya. We've upgraded our level 4 to level 5. Previously, we did not have an ICU or HDU in Kirinyaga. In the ultra-modern hospital, we will have this facility.
To reduce the number of referral cases in hospitals, dispensaries such as the complete Kavuti dispensary, a representation of 29 dispensaries in the county, will alleviate long-distance travel by patients.
The most important thing is to just realize how important it is to always have a contingency plan on how you will continue running in the event that there is an emergency.
Shortage of drugs and other necessities has been a headache that counties have had to contend with, as they have to rely on the Kenya Medical Supplies Authority, KEMSA, which has not been delivering as expected. Counties are having to contend with this, more so in a pandemic.
Every precaution should be taken to ensure that at any one time, if such an event occurs, that a country is able or a county is able to rise up to the occasion and ensure that they're protecting their citizens.
A decade ago, this hospital complex was nothing but a pipe dream. Today, it is the highlight of achieving devolution objectives, bringing sought-after medical services closer to the people. Melita Oletenges, NTV, Kirugoya Town, Kirinyaga County.